All right. Welcome, everybody. I am so excited to have Dr. Robert Melillo with us today in my virtual studio, who is going to enlighten us with 3+ decades of clinical experience in neuroscience and in primary reflexes, which is one of the reasons for our meeting today. So, Dr. Melillo, thank you so much for being on this call today.
Oh, thank you for having me. I really am excited about it, especially, like I said, know that you've been aware of my work for a long time, and I really appreciate that.
Thank you so much. Well, thank you so much for having such a spectacular, I suppose, opportunity for neurological healing. And I want to get right into it because I know there are thousands of mothers, especially, and fathers who will be watching this Zoom and trying to understand, what does primary reflex integration have anything to do with my neurodivergent child or with my child on the spectrum, and or how can I receive that sort of help in Australia, because we know lots of practitioners in Australia are Melillo Method trained. So I'm going to crack right into it. So for those of you, for those of us, or for those who are meeting you for the first time today, and you can see everyone's going to be like, what the hell, Jules is normally so confident, and today I'm like so shaky, and I'm like, oh my god, am I sounding all right? So please do forgive me. I think a couple of minutes into it, my nerves will calm down and I'll be a little bit more of a runny conversation together. So for those who are meeting you for the first time, Dr. Melillo, can you please tell us a little bit about your background and possibly what first sparked your interest in child brain development, functional neurology, and primary reflexes? Because chiropractic care is very big in Australia. It's even under what we call Medicare, which means it's under our green card system. I think that's what's called in the US, where the government allows X amount of consultations free under Medicare for every Australian citizen. And you did begin off as a chiropractor, if I'm not mistaken.
Correct. Yeah.
Mm-hmm.
So what started me in my health career like that was, one, I really fell in love in the end of high school with anatomy and physiology. I was an athlete, a really high level athlete my whole life. I was always into exercise and nutrition and diet before it was any sort of fashionable. And I was never a big fan of traditional medicine approaches, but I realized it was necessary for things. But I'd also grown up from the time I was a baby, going with my father to a chiropractor because he had a chronic neck problem from a car accident. So it was something that very early on I would get adjusted, but also, when I had athletic injuries, he was the one I would go see. I wouldn't go see my pediatrician. And he was the one that saved me many times, and my brother and my sister. And so it started out as athletics, and then after I was exposed to anatomy and physiology in high school, I realized I really wanted to go into that field. And I was thinking about going into orthopedics. Sports medicine hadn't really started yet, but I kind of had the idea that I wanted to do like a sports medicine type of thing. And but then, my chiropractor said to me, "Well, where do you go when you're hurt?" And I said, "I come to you." And he said, "So why don't you do that?" Because I said I wanted to work with athletes like me. So I did go, and as soon as I got there, I felt really comfortable. But, one of the first lectures I had was in neuroanatomy and neuroscience, and it was incredible. We had these amazing professors, and it just resonated with me right from the beginning. I loved it. I dove into it. It was the only textbook I probably read from cover to cover. And I got, straight A's in that. And it was just, I fell in love with it. So in my mind, some sort of neurological rehab, sports medicine type of approach to neurological issues was really where I started. But it was early, and it was that was like the mid to late '80s, and there wasn't a lot of brain, really great brain research. But then, right around then, started in the early '90s, because Bill Clinton had called it the decade of the brain. All of this new research came out, and all of these advanced ways of imaging the brain and even functionally measuring the brain with more sophisticated EEG and fMRIs and PET scans and SPECT scans. And all of a sudden, brain research exploded into the area was really looking more at functional connectivity.
Mhm.
Not like, is there a lesion in the brain? Is there a biochemical imbalance? It was more about the connectivity of the brain and realizing that that was the issue in almost everything.
Mhm.
But really didn't understand exactly what that meant. And a lot of information came out on, right and left brain research. So right after I graduated from chiropractic school, I went into a subspecialty board training for another 4 years in neurology. And I was one of the first people, I was the first person or people to ever get that subspecialty in chiropractic. And from there, I then went into the academics. They asked me to start teaching it. So I really liked doing that and then went into research.
Was it
But
at the beginning? Sorry for interrupting you, Dr. Miller. Was it in the beginning? Because you said I was really interested in athletics. So were you doing neuro rehab for sports injuries to the head? Was that what was?
no, no, it was really more about especially spinal injuries at the time or injuries that might have been neurological. But again, in the beginning, there wasn't a lot known about the brain, and no one was really talking about that as much in terms of rehab. There was no brain rehab at all. There was nothing, right?
Mhm, mhm.
Um,
Even now, I would say, when you said whenever my dad had a neck injury and he would see the chiropractor, did you, and it's a little bit of an odd question, but did you have to come from like here, you need to have some level of financial privilege to see a naturopath, to see a chiropractor. Your average Joe Blow, so to speak, are not going to be people who know how to see outside of, we don't go to pediatricians. We go straight to the GP, general practitioners, for anything, a cold, a flu, a fever. So would you say then it was normal for you in the late 80s, early 90s as a young boy to be seeing a chiropractor with your dad? Like, was that normal living in the
that was
US?
in the I thank you for the compliment that I was a young boy in the 80s and 90s, but I'm talking about 60s and 70s.
Wow,
Um,
incredible.
and in those days, yes, it was, even then, in the United States, actually, studies have shown really 15, 20 years ago, and it's even more now, that there were 10 times as many visits in the United States to non-MDs as there were to MDs. So from the
That's
very
incredible.
beginning, a lot of people in the United States really gravitated towards going outside of traditional medical realm.
And that's only
Um,
started in the last decade in Australia. When I
yeah,
graduated 16 years ago, which I feel like that's been a long time, I was probably one of the very few Muslim naturopaths in Victoria, maybe, yeah, one of the few. And only now I kind of feel like people are so open to holistic medicine. They just don't want kind of a symptom based approach. They want to really understand what's happening, why has it happened. And I always say we can't really do the healing process unless we understand why it's happened, and it's multifaceted.
yeah, I think, even back then, it all comes down to results. So even in like the 70s and 80s, doctors, MDs here were gods, meaning that, they were the highest and
Mhm,
they had that attitude, and insurance companies didn't rule them, they ruled insurance companies, right? So,
mhm, 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 mhm.
but the bottom line is no matter how you're perceived, are you actually getting results? And what also happened is, from my day, there were more acute injuries. You didn't have chronic illnesses yet
Mhm.
because lifestyle has changed so dramatically. And
Dr.
traditional
Melillo,
medicine,
I'm so
yeah,
sorry. It brings me to a very important question. I do apologize for interrupting you again. People here always refute, or they say that there was autism 50 years ago. You just didn't call it autism, or the doctor didn't know what autism was. Do you agree with that, or do you definitely see that there is a massive upspike of cases of neurological injury and or neurological diagnosis? I would say from the 90s onwards, but especially
yeah,
in the last 2 decades. How do you see that as someone who was a doctor in the 80s? Yeah.
yeah. So my third book was all about this, about, are we actually facing a true epidemic and why? and what are driving those factors. So, I'll go back and say that obviously autism was identified in the 40s by Leo Kanner
Mhm,
here in the United States and almost identically by Hans Asperger's in Europe.
mhm,
So it was recognized in the 40s. And
mhm,
before then, and again, these are built on traits.
mhm,
So there's always been people that have been these left brain dominant, brilliant, like, clearly Isaac Newton was an autistic savant, right? I mean,
mhm,
if you read his history about his personality, you would look at it and say he's probably on the spectrum,
mhm,
very high functioning.
mhm,
He invented calculus, right? But he was known that he wasn't a social person at all. He was obsessive compulsive,
mhm,
obsessed with numbers. So there are traits, and there always been people that have extreme version of certain traits, athletic ability, musical ability, math ability. These are the geniuses throughout history, but they were more balanced. And then there were people that weren't imbalanced. And those were the people that we might say they were, they had demons, in the old days, in biblical times, and say this
mhm,
person was possessed by a demon when it
mhm,
might have been autistic stimming or
mhm.
psychosis. You know what I mean?
Yeah,
But
absolutely.
but absolutely, there has been a dramatically sharp increase, really going back to the 80s, early 80s is when it started.
Mhm,
And so the idea that it was one in 10,000 in basically the 70s, and now it's one in 32, one in 28 boys, it's actually really, because those statistics are already old, it's probably more like, one in 20 kids,
yeah.
and
Mhm,
maybe one in 15 boys, maybe even one in 10.
mhm,
So you go from one in 10,000 to one in 10 in
mhm,
about 3 decades. And that
mhm.
is absolutely the fact. Anybody that denies that is not really looking at the whole picture.
Mhm. I appreciate that clarity because I have done some reading on the history, and I do agree with you that it was founded more so in the 1940s, but definitely massive increase. Even in experiences like post COVID, I moved my practice to pediatric naturopathy from general naturopathy just because of the spike in children who have began to have speech delay and other such neurological, I suppose, challenges. And that kind of brings me to an interesting question. I want to know your opinion on the term neurodivergent because it's now very widely used. And I feel like some families find it empowering and validating, and others worry it can create the impression that, a child's challenges are fixed and they can't be improved. I want to know how you view them and how you balance acceptance of a child's uniqueness, like referencing Isaac Newton as an autistic genius with almost zero social skills. Um, so, how do we balance that acceptance of a child's uniqueness with support, growth, development, and function? Because I'm finding as a practitioner in Australia, even online, people are even medical doctors, people in my field, people in any health field are very proudly labeling themselves, for example, as I have ADHD, I'm neurodivergent. And that I find sometimes in the people that I work with is very disempowering for children because when you're 9 and you hear that you've got ADHD, which is almost probably 35% of Australian classrooms now, I kid you not, then I find the children are like, oh, I can't concentrate. I have ADHD. So almost it's kind of like not so
I
much a
think
badge of honor, but a justification for why we can't sit down for
right,
30 minutes, age
right,
appropriately, because I also do understand I don't accept that from a 5-year-old to sit down and read a book for 30 minutes. But I do
sure.
anticipate that is something that should be experienced by, say, an 8 or a 9-year-old. What
Mhm.
what is Dr. Melillo's opinion on the term neurodivergent and how loosely it's became and how people are so quickly through not even DSM anymore, just a quick kind of check or through Instagram shorts or TikTok reels going, oh, that's me. I'm ADHD. No wonder I have had no success in my life or I'm so stuck on something or I don't have A, B, and C.
Yeah, I mean, all of these questions and all of this kind of confusion out there really comes down to one thing. You need to first answer the question, what is ADHD in the brain? What is autism in the brain? just
Hmm.
throwing labels out there. I
Hmm.
can't tell you how many patients I see that come in with a diagnosis and it's completely wrong.
Hmm.
And
I see that all
also,
the time too when I refer to psychiatrists and psychologists in Melbourne. And the psychologist diagnoses a particular person with ADHD. They go and see a particular psychiatrist. They do a QEEG scan, and they're like, your brain, the functioning of the brain is completely balanced, but the behaviors are very ADHD, and that is a lot easier to deal with than a brain that has higher spikes in the left hemisphere and not enough connection in the right hemisphere.
but to speak to that, because I do, very high level QEG as part of our research, and I do it in my practice, it's
Mm-hmm.
not sensitive enough to make that diagnosis. It may show differences, but
Mm-hmm.
you do have to look at the person. And
Mm-hmm.
that's where a lot of people make mistake. They
Mm-hmm.
treat from an EEG or from an MRI and not actually,
From a
because
questionnaire.
again, it comes down to you need to really understand neuroanatomy and you
Mm-hmm.
really understand neuroscience. And to be honest with you, there is very few, almost zero people out there at any level, PhD level, MD level, surgeon, neurologist, whatever you can say, neuropsychologist that really understands actual functional advanced neuroanatomy and neuroscience, especially in a clinical setting.
Mm-hmm.
So a lot of the things that are thrown out there to me just come from ignorance. Like with ADHD, even there's a ADHD type 1, type 2, type 3. Type 1 is typically more of a left brain delay with overactivity right brain. These are people that are super creative, artistic, musicians, artists, athletes, comedians, chefs. These are these right brain dominant people, and the left brain delay is often more associated with dyslexia or dyscalculia. That is a completely different, opposite ADHD than type 2, type 3, where you have a really strong left brain that a kid might be really bright academically and advanced, but really struggle with sustained attention and also emotional regulation and socialization and doesn't really pick up on the rules and is constantly hyperactive, has to move. They're completely two different people. So
Mm-hmm.
you throw
Dr.
out
Melillo,
there, I'm ADHD, and again, what does that mean? It's, and
yeah.
that's why you hear it. You hear one person describes themselves as this creative type, and then now there's a term called odd ADHD, which is autism and ADHD, which actually is the classic model. They're both right brain delays, and they're very similar in many ways. Autism is typically more out of balance, but that's completely different than the person who's really more of a dyslexic, learning disabled individual. And
Mm-hmm.
so, that's why those terms mean nothing. And it's frustrating to me.
Mm-hmm. I share the same frustration. I think because the term doesn't, in and of itself, give us much of an understanding of the why. Because then I understand that we're on the same page in seeing any sort of neurodivergence as a maybe functional brain. I don't want to call it an injury, Dr. Melillo. You probably have better words for it than I do, because if it's increased since the 80s, then I would assume that there's this imbalance in the brain, even though technically there's some beauty of it in terms of some genius coming from it. But then
Exactly.
your ability to mostly, regardless of the type of ADHD that you have or autism, but let's stick to ADHD because it's, I suppose, easier diagnosed and kind of doesn't have very specific, I suppose, social disorders associated with autism. But everyone just uses that term haphazardly. And then we kind of wear it like it's our personality now. And any one of us do not come close to the, 30, 40 plus years of research that you've done. So I really appreciate you clarifying that for us, which brings me to
Yeah.
my,
So, but let me speak a little bit about the term neurodivergent. So
please,
the
please.
term itself, I don't have a problem with because it basically is saying that these are normal or these are traits. There's no defect in the brain. There's no genetic mutation.
Mm-hmm.
There's no metabolic disease. if we're
Mhm.
talking about people that aren't really traumatized as a child,
Mhm.
you know, then what is it? It's really built on traits that are there. And what we see is the way traits work. So, yes, it isn't a divergent, it's a divergence in traits, right? But so there was a really good article a few years ago by a psychologist called the Unbalanced Mind. And he
Mhm.
was talking about, certain disorders like bipolar, autism, and schizophrenia
Mhm.
that when we look at traits and how they get passed on, right? They run in families. We obviously know how they get passed on, just like eye color, hair color, all of that. We have traits. And there was a recent article in Scientific American based on a really good scientific paper that came out in Nature saying that they identified 39 traits associated with autism spectrum,
Mhm.
which the combination of those different traits could explain a lot of the spectrum, the fact that there's a wide variety of differences.
Mhm.
And those traits in the brain that build brain networks are much more susceptible to environmental influences, meaning where we do know, like if you're undernourished or whatever, you may not be as tall as you should be,
Mhm.
or two twins. One could be much taller.
Mhm.
You could have, maybe even different color hair or eyes. But for the most part, identical twins are going to look identical because of the DNA. But the brain traits are much more malleable because that's the way the brain is built and that's the way the genes that regulate brain. They're meant to be adaptable. And so, therefore, the traits are more susceptible to changes. And basically, a trait that builds one part of, let's say, language on the left builds a completely different part or opposite part of that language on the right. So this is an advantage, the biggest advantage. But what they showed talked about in this article is that those three conditions, unfortunately, from an evolutionary fitness, right? Evolutionary fitness means, are you likely to pass on your genes and have offspring? I mean, that's obviously key to survival for a species. Anything that takes you away from having offspring is usually, a trait that is eventually going to go away because you're not going to pass on your genes and is disadvantageous. So if the genes, schizophrenia, autism, and bipolar, they end up having much less children or almost no children compared to others, right? When you talk about different levels.
Mhm.
So
Mhm.
why would those genes be exploding in the environment, right? Why would we see this epidemic?
Mhm.
Because the trait at a certain level gives a great advantage to survival. And that advantage goes up and up and up and up until you go over what's called a cliff edge, where
Mhm.
now it becomes a sharp disadvantage. And that's when that trait enhances certain networks on one side so much, they become so powerful, but they
Mhm.
end up inhibiting the other side so much that now it becomes a disability. And that is why we see that, yes, they are neurodivergent. And at some level, it's a great advantage. They're smarter in certain things than other people by far, and they may know it. And they may be weaker in other things, but their strengths outweigh their weakness. But when
Mhm.
you get into the realm of like non speaking autism, clearly the disadvantages are outweighing it. So you get some high functioning autistic person who may say, I'm great. I'm smarter than you. Leave me alone. I don't care if I don't have relationships. I don't care if I have children, or I don't care if I have some anxiety, right?
Yes. Mhm.
But
Mhm.
then you look at the non speaking kid and we get them to spell, which is a fascinating thing we should talk more about.
Mhm.
And the
Spell.
first thing they say is, please help me speak. Please help me stop stimming. That's all they want at every age. So to say that, well, the only thing is to accept them, label them, say they're neurodivergent, and that's the way it is, and that's the way it's always going to be, and you can never change it. That's completely false. And that acceptance, to me,
Mhm.
as you say, it becomes, first of all, it's
It's
really the
empowering.
choice of the individual,
Yeah.
but we can keep their genius and take away all the disadvantages. And in the autism world, and in OCD and in dyslexia, there are so many disadvantages that go along with it.
Yeah, absolutely.
Like, in dyslexia, things like suicide.
Hmm.
So, wouldn't we want to intervene and change that if we could
Absolutely.
without taking away their gift?
Hmm.
I always say I recognize that anybody that I work with, it's because they're brilliant in an area. They're more talented, but the more talented, the more stronger that trait is, the
The
more
struggle.
likely they have a struggle on the other side. And then if anything interferes with their development, and right now, what we know is that movement is what develop brains on this planet.
Hmm.
And movement is what starts the whole brain process. That's why
Hmm.
the primitive reflexes are so important. But since the 80s and the development of the personal computer, we have gotten more and more and more and more sedentary. And our inflammation has gone up, our body fat has gone up, our muscle mass has gone down. And with that, what happens is all of those things are suppressing the genes of the parents, and especially the genes for brain development, which 84% are active during brain development. 40% of our genes are just there for brain development, and they're the most susceptible genes. So
And
why
do you
is
think
this
they're
happening?
susceptible for environmental toxicity, environmental insult, chemical insult, psychological insult? Are these the
Not
things you're
not
making?
even insult, but they need, primarily motor sensory stimulus. That's
Mhm,
what turns them on. If
mhm,
they don't get that stimulus, they don't turn on,
mhm,
and they're delayed. But then you can also have chemical factors and stress factors and age factors. My third book, we go through 50 identifiable, and it also any imbalances in the parents.
mhm,
Because most of the factors that lead to autism are actually preconception present in the parents. So
mhm,
they're modifiable. If you're aware of it, you could actually lower your risk of having a child by being aware of your hormone levels and your inflammatory levels. And if you have food sensitivities, and if you have a neurological imbalance in your brain and your traits and where your gifts are, you get two really strong left brain dominant people, you have a higher risk of having a child with autism or ADHD. You have a right brain, left brain dominant person getting together, your risk goes down. You have two right brain, you're really at risk for having a child with dyslexia or severe anxiety or ultimately bipolar. So,
mhm,
it's about that awareness. And, the idea that we have environmental toxins and everything like that, yes, I mean, pesticides and, plastics and hormone disruptors definitely play a role. But it also is based even more on traits, natural traits that are a good thing. And
mhm,
the fact, if we're not moving, that's the biggest influence on brain development. If we're not
mhm,
engaging and we're not getting the appropriate level or a balanced level of sensory feedback,
mhm.
and that
That's
is the biggest factor.
that says a lot about why so many more children came out diagnosed post COVID or during COVID, because in Australia there was massive lockdown, no communication, no child seeing another child. Some of the parks were closed down. But then my next question to you is this, Dr. Melillo. So traits is a term that you're using instead of genes. We acknowledge, even I acknowledge as a health practitioner, that there are certain tests that I do through gene testing, comprehensive DNA analysis where you look at somebody and, there's APOE gene mutation, MTHFR. They're not prevalent in every single autistic child. So we can't necessarily say that every autistic child has an APOE gene mutation. But do you, as a practitioner, and within the Melillo method, which I'm going to ask you about now, do you find benefit in doing gene testing to kind of go, all right, this person has, this child has an APOE gene mutation, possibly their exposure to heavy metals has left them neurologically imbalanced, let's call it, instead of a brain injury per se, because we're talking about functionality. Like you said, in the MRI or any scan, you don't see the brain being any different outside of its functionality. Then do you, within the Melillo method, I'm going to ask you about what that is. It's a world-renowned method now, and thank God for it, because I know that I can vouch. I'm going to confidently and humbly say over 100 plus, maybe hundreds of patients of mine have utilized the Melillo method, whether they've traveled to the US to see you and your team, whether they've spoken to different Melillo trained chiropractic practitioners around the world, because working on Zoom, I get the privilege of having patients all around the world. So do you, in your method of the Melillo method, do you credit gene testing? And if you do you credit it in understanding why the brain has this neurological disconnect? Or do you not phase it that much and kind of go, it's the traits, we're keeping all the good stuff, we're a genius in A, B, and C, but we're just kind of down regulating all these symptoms that are not really viable when you lack the social skills in the 21st century, or you lack the capacity for fluent speech, so on and so forth?
Yeah. Well, first of all, again, we have to be careful of what we call a gene mutation
Mm-hmm.
versus a single nucleotide polymorphism.
Mm-hmm. Which is the
Uh,
latter, not the former.
right, versus
Yeah.
an epimutation, right?
Mm-hmm.
Meaning that the most common effect on genes is what we call epigenetics,
Mm-hmm.
where they're not
Right.
mutated, they're not damaged, but they aren't active when they should be, and they're kind of silenced or they're slowed down because of things like methylation, DNA methylation, but they're not damaged in any way, as opposed to a true gene mutation like a gene deletion,
Mm-hmm.
or a really different form of an allele. So
Trice. Yeah. Mm-hmm. Like
yeah,
trice.
so it's
Yeah.
it's right. So and even in the autism spectrum, there are two different main subsets, what we call syndromic and non-syndromic.
Mm-hmm.
Syndromic means there's a clear genetic mutation, whether it's inherited, or what we call a de novo mutation, where the
Mm-hmm.
gene is actually altered, physically altered or
Mm-hmm.
deleted. And that clearly is going to have an impact, but it may, in some people, it may only be more of a physical impact. Other people, it may be more of a brain impact. And a lot,
Mm-hmm.
it's a combination. Like Down syndrome, Fragile X, tuberous
Mm-hmm.
sclerosis, Landau-Kleffner.
Trice.
And that's only about 5% of autism, right? So, and one of the main things is that they almost always have facial features. To me, if genes are really having a big penetrance on affecting the brain, we usually clearly see a facial feature that is what we call syndromic.
Mm-hmm.
Um, if you see a child that's like beautiful and perfect, I don't really think, even if they have an identified gene mutation that doesn't really, they may not know what it affects. I don't really think it's having that big effect on a child.
Mm-hmm.
So
So
if
there
there
is
is a,
no genetic relationship between autism and a gene, or you're saying there is in maybe 5%, and that's also labeled as some other neurological condition. It's not just called
right,
autism,
and
it's
it
called
looks very different.
triassiated. Yeah,
Right.
yeah.
And it looks
Down
very
syndrome.
different.
Yeah, yeah,
There
yeah.
are, they have a genetic disorder, maybe
Mm-hmm.
non-named, and
Mm-hmm.
they have autistic features, but it's
Mm-hmm.
very different. It's equal in boys and girls. They almost always have facial or physical features,
Mm-hmm.
and they're globally low in everything. They
Mm-hmm.
don't have like an unevenness of skills.
Mm-hmm. Mm-hmm.
And then you have the 95%
Mm-hmm.
that there isn't any really identified, for certainly not single gene mutation. You
Mm-hmm.
know, people may talk about networks, but that's not clear. But it's not a gene mutation. It's epigenetic
Yeah,
and it's driven by that. Now, you can also have people that have, again, different versions and single nucleotide polymorphism. And
such
that's
as
where people,
MTHFR.
some such as
Yep,
MTHFR. But how much that really plays a role, I think that's been,
not very
I
much.
think, no, and I think that's been totally overblown. And
Yeah, I
mainly it's
agree.
by people that really don't know anything about the brain.
Mm-hmm.
And so, you know, it speaks to this. Like, so let's say we talk about, you know, especially the people in the anti-vaccine world, right? Which
Mm-hmm.
I understand it. I'm not saying I'm one way or the other. The point is that, you know, I don't believe vaccines cause autism per se, right? Meaning that
There is
if
no
every
direct
if vaccines caused autism, every child that was ever vaccinated would have
be
autism.
autistic. Correct.
That's not the case. It's only about 2 to 4%. So if you say that to people that are really strongly in that belief, they'll say, yes, yes, okay, I understand that. But there's something different about these children that make them susceptible. Okay, I get that. But what is it?
Hmm.
And I'm talking about that their brain is already out of balance, their networks are out of balance, there's imbalances in the sympathetic and parasympathetic, and they're inflammatory and they're anti-inflammatory, and they're producing too many antibodies in their Th2 system, which we just wrote a massive paper. I don't know if you saw our paper on neuroimmunology that we just came out with. It was great. And but they'll look at it and they don't understand any of that and they don't understand the brain. So
Hmm.
they say, well, it's got to be something else genetic. Well, what? It's not a mutation. Well, the MTFR gene. That's the cause
No.
because that they're not methylating. And
Hmm.
then they go through a whole thing that they're not methylating and it's inflammation. And then the inflammation goes to the brain and causes autism and ADHD and schizophrenia, just like it doesn't start in the gut, and I understand that, people believe that and learn that. It's not how it works. I mean, again,
I think it's multifaceted, Dr. Miller. In my experience, and I humbly want to drop a comment here. In my experience, we don't. I completely agree with you that we don't say every child who is autistic has MTHFR. Therefore, MTHFR polymorphism cannot be singled out as a cause or every child who's autistic. I agree with that 100% because in my experience, even my small cohort of people that I work with around the world, not every one of them has the MTHFR gene mutation. What I do see though let's stay on task of MTHFR. For example, if you are giving very high dose active folinic acid for someone who is homozygous for both the genes in MTHFR, and therefore there is, let's say, a 40 or 50% decrease in that pathway, I do see a benefit. But when the lab results come back and they say 20% it's heterozygous, we don't even worry about it. But I do see the difference between if it is homozygous, even though it's not a gene mutation, it's a polymorphism, then improving that absorption of folate, or even sometimes taking out artificial folic acid, which is, I think it's very common in the US because you're there. Very common in Australia. All wheat is fortified with artificial folic acid. In some children does make a difference, but I do agree with you that even with the gut, there are children that I know have gone through the Melillo method, through chiropractic. The moment their primary reflexes are integrated, the child starts to speak. And I've been working on the gut for the last 4 months with not much of a change neurologically. There's been a change in sleep, there's been a change in overall temperament, energy, but we're still not talking. And then I send them to a Melillo trained chiropractor who checks for retained primary reflexes. And depending on the child, too, some children can integrate within a couple of sessions. I've had children where, bang, if they're very young, the integration is almost immediately. And then speech comes back, and the parents are like, they think that the chiropractor's the hero, like, oh my God, that's the best chiropractor in the world. But the reality is it's because the chiropractor's working on the correct thing, which is primary reflexes. And so that brings
yeah.
me to, yeah.
Well, let me comment on that. First of all, there are many practitioners in every specialty that are certified in the Melillo method, not just chiropractors. There's naturopaths, there's psychologists, there's MDs, there's
I need to come over
naturopaths.
and get trained because you just left Australia.
Right. So it's not in the beginning, it was obviously primarily chiropractors, but now it's actually even more other people other than chiropractors. So there's
Mhm.
many different, and there are a number of MDs that are really trained in it. But so I'm not saying that the gut isn't an issue. I'm not saying that detoxification isn't an issue, that a folate deficiency or a vitamin D deficiency or, having dysbiosis in the gut or having inflammation isn't a problem and it's not creating symptoms and making things worse. But it's not the root
The
cause.
driver. Yeah, I
And,
understand.
and even when you're talking about you give someone folate and they get better and they have an MTHFR gene, but are those two actually related, right?
Mhm.
Because folate comes connected to food, right? So it comes connected to a protein. What we know is that kids
Inactivity,
on the
correct.
autism spectrum are in a very sympathetic dominant state, which
Mhm.
means that we're all born with an open leaky gut. That's how we're born.
Mhm.
And right around when we start ingesting food, it should start being closed or close up. So it doesn't just happen out of nowhere from a mystery or
Mhm.
by what we eat.
Mhm. Big
Um,
insight.
we And this is all driven by parasympathetic. And we then, when we eat food, the gut closes up and then we start producing acid and enzymes. In the beginning, we're not, because
Hmm.
the gut is open in the beginning because the baby gets their antibodies from mom. They don't have an adaptive immune system yet.
No.
That needs to evolve over the first year.
Hmm.
So they need to get the antibodies from the mom, which are large immunoglobulins. They're large proteins. If we had acid and enzymes being produced, it would digest those proteins and it wouldn't be what we would want, right? So we don't have a lot of acid and enzyme. We don't have a lot of blood flow. And that's the way it should be in the first 6 or 7 months or so.
Hmm.
Then as the reflexes go away and the brainstem matures, the other major nucleus now is the parasympathetic. It inhibits the sympathetic,
Hmm.
activates the gut nucleus. It
Hmm.
closes up, produces acid and enzymes, gives the right balance so that it kills any bacteria, mold, fungus, yeast, parasites that might show up in the in the gut on this solid food now that we're eating.
Hmm.
Um, and then also increases blood flow so we can absorb it. So folate comes attached to a protein. You need
Hmm.
the acid first of all to separate it. If you
Hmm.
don't have acid, you're not gonna absorb folate. It's not gonna
Hmm.
happen.
Which is a
If
general
you
problem in the Australian population to begin with. High,
right,
like low stomach acid. Yeah, let
and
alone children.
and if you
Yep.
don't have enzymes, then you can't break down the folate into
Hmm.
usable
Amino acids.
folate to be used.
Yep.
So virtually every kid on the autism spectrum will have a folate deficiency. They will have a B12 deficiency because you can't absorb B12 without acid or intrinsic
Hmm.
factor.
Yeah.
Almost all vitamins will be deficient.
Hmm.
But you
Correct.
look at that and say, and you give them folate in a
Hmm.
way that they can absorb it and take it, or you give them a B12 shot that bypasses their gut and they
Hmm.
seem better
Hmm.
because we all need those vitamins and they're not getting it. And
Hmm.
you can say, oh, well, that's because of the MTHFR gene. Well,
Hmm.
maybe it's just that they can't absorb it.
Hmm.
Maybe it's a little bit of both, right?
So you're saying it
But
probably weighs the most as any other nutritional deficiency, regardless of
exactly,
the polymorphism being there, because there could
exactly,
also be one for B12, or for iron or molybdenum or selenium, but we're not testing for that. But had we, then perhaps we
exactly,
could also find the polymorphism there too. Makes so much
exactly.
sense. Thank you
And
so
the
much,
idea
Doctor.
also is that when we look at detoxification,
Mm,
it's not just methylation. What's the first and major way we detoxify things? They have to go through the acid in our stomach.
yes.
Toxins are going to be denatured and kind of killed there.
Hmm.
And so, therefore, and then we have pancreatic enzymes. And we know if
Hmm.
we're in the sympathetically dominant state, we're not producing pancreatic enzymes.
No, it's suppressed
So
productivity.
there's
Right.
many other factors. And so looking at, well, they can't methylate because they don't have MTHR. To me, that doesn't really make a lot of sense. And there's other factors that they're not considering. And also, what's the source of that? It's really in the brain, in the brainstem, and those sympathetic and parasympathetic nuclei at the beginning.
Mhm. Thank you so much. Love that. Extremely interesting. Dr. Melillo, I know we're getting to the end of our time, which I'd love to sit here with you for hours,
This
but I know
went
we're
fast, right? This is fun
I
with you.
know, I know. Time flies when you're having fun, they say in Australia.
Yeah,
Now, I know that the Melillo method is known around the world, but every approach starts somewhere. So I want to ask you, outside of the fact that you were interested in sports sciences or sports injury recovery, what observations led you to develop the Melillo method? And what problem would you be trying to solve that wasn't being adequately addressed by conventional approaches? So, when was the Melillo method born in understanding more movement for children, less movement means the brain connections are not as balanced? When was the Melillo method born as an idea where it was your aha moment? Because I
yeah.
know
So
even though adults can have primary reflex, I don't even think disintegrated is the correct word, but I know primarily much of your work is with children who are neurodivergent or neurologically injured, if we're speaking about specific negatives associated with autism. And other
Yeah.
other
And
speech
again,
dyslexia.
let's
Yeah.
say they're not injured because their brains look perfectly normal.
Hmm.
So, and that's one of the things I think also that, but really it happened because this was my journey that I talked to you about. And eventually I was also all my children were diagnosed with something or
Hmm.
had certain issues. My oldest at first they said ADHD. Again, didn't really know what that meant. My youngest was really more on the autism spectrum. My middle child was really dyslexic, but they all were really talented at certain
Hmm.
things. And that was confusing to me, like most parents. Like my daughter was writing full songs and she's now, one of the up and coming songwriters in Nashville. She's really like a genius with songwriting.
Hmm.
So, but she had trouble writing and spelling. How does
Hmm.
that work?
Hmm.
So I really then turned my research because at first I went out and asked friends. I asked pediatricians and other doctors and people that I knew, and I said, "What is it in the brain?" Like, because I'm a rehab guy, just tell me. I'm going to try to fix it. And they were like, "Oh, nobody knows that." And they said, "Why?" I said, "Because my child, got this label." And they said, "Well, you can't do anything about it."
Mm.
I said, wait, you just told me you don't know what it is. I was already teaching clinical neurology.
Mhm.
So I knew a lot about the brain for that time and
Mhm.
research. And I'm like, wait, what you're saying doesn't make any sense to me. I quickly realized they had no idea what they were talking about.
Mhm.
So then I started doing the research on my own. I turned my research towards what are these things? I was seeing more patients in my practice where the parents were saying, my child is labeled with this and this and this. And now, as a parent, I'm concerned. What am I not seeing? What am I missing? And that's when I started really connecting with researchers around the world and reading papers on people that were starting to go in this functional network communication way. And so I really went down that and connected and eventually teamed up with a really top researcher and we became research partners and we published a book on our findings over 10 years in a book called Neurobehavioral Disorders of Childhood and Evolutionary Perspective, which I think we set the best model at the time. And what we said was we kind of understood this disconnection between networks and these hemispheres, but we didn't know why or how. And that's when we turned towards development. So I also
Mhm.
have a degree in, development in clinical rehabilitation neuropsychology. And
Mhm.
when I realized that, this is really all about human brain development, I
Mhm.
then, turned my research there and I have a PhD in developmental cognitive neuroscience. And that combination of knowledge, my chiropractic background, my neurology in chiropractic subspecialty, my specialty in rehab, my specialty in neuropsych rehab, and then my PhD in cognitive development really gave me this really broad perspective of what was going on. And I think it's unique. I really don't think there are a lot of people that understand the brain like I do, but also have 35 years of clinical experience of working with it. And so
Oh,
I think
absolutely.
I have a unique perspective. But when it was my children, that's what drove me there, right? So as a parent, so I empathize and completely relate to parents.
Mhm.
And also teachers. Teachers have given me a lot of information that doctors don't know. So like when I
Mhm.
first started seeing this epidemic rise, I was a little skeptical about it. I went to a patient who was a teacher, an elementary school teacher here for 30 plus years, and I said to her, "Is ADHD real or is it just being diagnosed?" She said, "Oh no, it's real. Like you can't believe the difference in kids nowadays."
Mhm.
And so I said, so she gave me some insight into that, and I said, "Why?" She said, I don't know, but it has something to do with kids don't move their big muscles anymore. They're not
Mhm.
moving. I watch them on the playground. They don't move anymore. You drive around the neighborhood, they're not climbing trees and riding bikes. They're
Mhm.
sitting inside watching TV or they're starting to watch these computer things. And,
Mhm.
uh, and so when she said that to me as a rehab person, that resonated with me. I was
Mhm.
like, I understand the importance of movement in the brain. And
Mhm.
now it was like, oh, okay, now I kind of see it. And
Mhm.
that really informed a lot of my research moving forward. And that's also informed a lot of the treatment plans and ultimately leading to understanding that all movement starts with primitive reflexes.
I love
But
that.
the real key thing to my work to understand is it's not just about the primitive reflexes. It all the symptoms come from the neurological network imbalances, and that's where all the symptoms lie. That comes about in many places secondary because of the primitive reflexes being retained and how it may alter movement and asymmetry, but those two are intimately involved. If you're just doing primitive reflexes, you're not doing my work. And you may get some results, but you're not getting the best results.
Well, yeah, I understand that.
If you're just doing hemispheric imbalances, you're not doing my work, right? Because both of those things, along with diet and nutrition,
Yeah,
and
yeah, yeah.
along with all of that, all of it works together. And that's the Melillo method. It's very,
Holistic.
it addresses everything. But
Mm-hmm.
also, what makes it very special, and nobody knows this unless they come to our office, because even at the basic level of teaching, it doesn't have the complexity that, every treatment plan is individualized based on functional assessment, examination, and objective measurements. We translate it into very specific goals,
Mm-hmm.
functional and developmental goals. So, parent comes in, a patient comes in, and we work through any age. We work with adults because we know that almost all adult mental health issues like bipolar, schizophrenia, anxiety, OCD, it all starts in childhood. It's all
Mm-hmm.
developmental. Our
Mm-hmm.
brain is still developing up till 35 based on new research.
Mm-hmm.
So, schizophrenia shows up at 25, but it starts in childhood.
Mm-hmm.
Um, so what we're doing is it's very goal directed, and we have daily goals for each activity. There may be 20, 30 different exercises, activities, stimulation that we may prescribe. But each one of those has a goal every day that's measurable.
Mm-hmm.
And we have an overall goal of where we're going to get to. So there's a very clear roadmap, which parents come in and they say to us all the time, nobody ever gave me this. They were just trying to manage symptoms.
Mm-hmm.
They're not
Absolutely.
trying to, and what we're doing is the symptoms aren't you can't objectively measure many of them and behaviors. Those symptoms are related to imbalances in networks in specific areas of the brain. Those
Mm-hmm.
areas of the brain control functions as well. And we can measure those functions and we can objectively change those functions and we can put them on a developmental scale. Are they immature? How immature? And then we know the individual's age. So we know where we want to get them to because essentially we're just trying to get the brain to catch up. That's what we're doing. And we're
Absolutely.
trying to get the networks to catch up.
Mm-hmm.
So, it's given in a way where, parents are trained to go home, look at
Mm-hmm.
this, carry this out, and look at very specific goals. So symptoms may change and be confusing. We're just looking at the numbers. And if the numbers are going there and they hit their goals, that's it. That's our goal. That's what we're doing for. So there's a very clear time frame. It's just a very well combined program that combines everything with
Mm-hmm.
the cutting edge neuroscience and cutting edge tools, but
Mm-hmm.
it's also goal directed and objectively measurable and data driven every day.
I love that. And I completely agree with it because I have seen firsthand myself as a health practitioner how many of these symptoms can be reversed or healed, or how the brain actually catches up to its biological age when methods like the Melillo method are implemented. And I do understand how holistic you are because I understand there's a nutrition aspect, there's a supplementation aspect, there's an aspect of red light therapy, there's an aspect of TENS machines, you do lots of different exercises, and you also leave parents with a set of, I suppose, activities to do and nutrition to take to kind of go, now let's continue this at home, which is very empowering because a parent doesn't have to go, I've got to keep going there for 9 months. I can do my 3-month rehab, go home and implement. These are the areas that I'm left with in terms of my child's brain development. So in wrapping, even though I have so many more questions to ask you, Dr. Melillo, lots of parents are going to be obviously watching this, and many parents have never heard of the term primary or primitive reflexes. Can you explain in very simple terms what are primary reflexes and how they affect learning behavior, emotion, coordination, sensory processing if they remain active beyond infancy? Because this is an area that I'm challenging explaining to my patients. Are like, what do you mean? I'm like, well, the brain only has it until 3 months or 6 months and it's retained, but it's not supposed to be there. So if it's there, the brain is not developing because the brain still thinks I'm a baby. I still need the rooting reef. I still need to suckle on the nipple. So
Right.
how would you
Because
explain?
I really got
Yes,
quickly. So,
yes, please.
um, human brain is unique amongst any brain on the planet. We have the largest brain per body size of any primate, but because we're bipedal and the only ones, we have the smallest birth canal. So where every other animal, anywhere from 80 to 100% of their brain is formed in the womb, where nothing really usually goes wrong. Humans only have about 20 or 25% because we can't fully grow in the womb. So that means that all of these developmental milestones and everything that occurs over the next 35 years can have an impact and throw our brain development off. The brain is so immature at birth, we need to move to engage the world, to activate the senses, to turn on the genes to build our brain.
Mm-hmm.
But the part of our brain that we use voluntary control isn't there. We don't have control over our movement. So this is why we have primitive reflexes. They're these basic programmed reflexes that we see in lower animals, and it allows us to get into the right position to be born without the cord wrapped around the neck, to move down the birth canal, to be upside down and backwards, to be able to not be sunny side up. And then they push themselves out of the birth canal so that they don't need forceps or assistance or a vacuum. They don't need to be induced because they push themselves down and that causes the water to break and all of that, right? So if any of that happens, it means the reflexes aren't there when they're supposed to. They're already delayed. And then
Wow.
when they come out of the womb, first one is, can they breastfeed? Can they suck if a mom chooses that? 90% of the kids we have can't speak. They never latched on. They didn't have the rooting and sucking reflex. It wasn't there on time. And then that leads to other delays and rolling over and commando crawl and crawling. And especially if they do it where they're moving one side and not the other. And
Yeah.
then ultimately at 12 months, every child should walk a few steps, talk a few words, and point and have clear eye contact. If they don't reach that, or if they reach it and then they lose it suddenly with regression, that is because the primitive reflexes didn't go away.
Mm-hmm.
And the right brain is taking the lead in development for the first 3 years and then the left brain. That's the way it's supposed to be. But if
Mm-hmm.
the primitive reflexes don't go away, it it now has the opposite. It leads us through that early development, and then it needs to go away for the brain to now explode into its most expansive growth phase from year 1 to 2. But if they
Mm-hmm.
don't go away, they hold it back. And now the right brain loses its advantage. And in a kid that is really super gifted, like all kids in autism are, it comes online too early and either stops the right brain from developing or pushes it down. And that's what regression is. That's what
Mm-hmm.
we see regression, anywhere between 1 year and 3 years. And that's basically why we need primitive reflexes to be there and go away. They're the
Mm-hmm.
foundation of all movement. Okay. And I'm sorry, I have to go.
Thank you so much. I can listen to you the whole day, Dr. Miller. You're not short of a pleasure and an absolute breath of fresh air to speak with. Thank you so much for enlightening me today. And I really push my luck and see in the next coming months if we can do a second segment because I have so many
That
other
would be great.
questions to
Yes,
ask
there's
you.
so much more.
That-
And just to let everybody know, everything I'm talking about, I've researched, it's out there. My
Oh,
books
absolutely.
describe this, and we also have almost 200 scientific papers.
And you've
We have
got an
15.
excellent website. Very,
Yeah.
very
So
informative
it's all, and
website. Speaks all
My Instagram really
the
explains a lot of this stuff. So,
absolutely.
okay.
And
Thank
I'll
you so
tag all that.
much.
Thank you very much. Take care of yourself. Absolute pleasure.
Okay.
Thank you, Dr.
Bye.
Melillo. See you later. That was absolutely amazing, guys. Hopefully, we'll do a second part to that. It was 6 a.m. in Australia, so the sun is not even up yet, which is the reason why the room is so dark. So I hope that's enlightened you. It's an absolutely brilliant method, and it's really an opportunity to get the brain to catch up to the delays that it has, regardless of why it has been delayed. I will be sharing with you Dr. Melillo's books, his Instagram page, and there are a lot of Melillo trained practitioners in Australia who've done his course, who, like me, integrate a very holistic approach to integrating the primary or primitive reflexes that have been that have stuck and that have not integrated, and as a result the brain doesn't develop because it thinks it's still a baby, or it thinks that it still requires those reflexes. So thank you so much for being here. Please post any question that you might have below and we'll see if we can get you a response.